Hello everyone, welcome to today's lesson with Caleb Mlonga. Today we are looking at the nursing care plan for tuberculosis or PTB, which is pulmonary tuberculosis. So we understand that we're going to look at 5 problems, of which we are going to mix actual problems and potential problems. So without wasting much of our time, let's go into the topic, the nursing care plan. So the first thing that we do on any nursing care plan, in any nursing care plan, we start with the assessment. Remember, assessment, we're not going to put it in the table, but we have to make sure that we do a quick and thorough assessment so that we can easily come up with our problems. So the first thing that we have to know is that our patients with pulmonary tuberculosis that they experience difficulties in breathing, and you find that they can also have hyperventilation. So this is because there is inflammation in the airway, and there's also buildup of secretions in these in the airway, the lungs, where everything inclusive there. So you find that because of that, we can identify a nursing problem, which is ineffective breathing pattern. Ineffective breathing pattern. So that is our nursing problem. We move to the nursing diagnosis. Our nursing diagnosis is ineffective breathing pattern related to narrowing of the airway evidenced by rapid respirations of 22 breaths per minute. So we're just saying that our patient will experience rapid breathing or rapid respiration. So that is our nursing diagnosis. Remember, this is an actual problem, so it will have related to and evidenced by. From there, we look at our goal. Our goal is the patient will have normal breathing pattern within 30 minutes of hospitalization. So we are saying that in our goal here, we want our patient to have normal respirations within 30 minutes. And remember, each goal has to be SMART. From goals, we now look at intervention. I will position the patient in semi-Fowler's position to promote full lung expansion. So we're going to put the patient in either semi-Fowler's or Fowler's position to promote full lung expansion. Number 2, I will administer supplemental humidified oxygen at the rate of 4 to 5 liters per minute to improve tissue oxygenation. So we are going to make sure that we give humidified supplemental oxygen so that we can give the patient enough oxygen because they're having difficulties in breathing. And this will help in terms of improving tissue perfusion. Number 3, we are saying I will administer prescribed intravenous fluids such as normal saline to aid in loosening tracheobronchial secretions for easy expectoration. So what we want here is that when we give these fluids to the patient, they will loosen up those secretions that are in the airway. Therefore, it will be easier for the patient to spit them out, therefore helping in clearing the airway. The last point is I will check the oxygen saturations using a pulse oximeter to monitor the patient's response to the oxygen therapy. So we're going to make sure that we check the the oxygen saturations using a pulse oximeter to note if the patient is responding to um, the supplemental oxygen that we have given. So those are the interventions that we have under ineffective breathing pattern. Then from there we go to evaluation. So under evaluation, we're saying patient had normal breathing pattern within 30 minutes of hospitalization, evidenced by normal respirations of 16 breaths per minute. So it can be 16 to 18 or 16 to 20 breaths per minute. So that is our normal range. So we move to the next problem. So you find that in our patients with pulmonary tuberculosis, they will experience chest pain. And this chest pain is simply because of the inflammation that is taking place in the lining of the airway, and also because the nerves are now being affected by this inflammation. Remember, one of the four cardinal um, signs and symptoms of inflammation is pain. So there will be pain in the chest. So that is why we are going to go with the next problem, which is chest pain. So chest pain, nursing diagnosis will say chest pain related to inflammation of the inner lining of the airway, evidenced by patient's verbalization of pain. So because of the inflammation in the inner lining of the airway, the patient will experience pain. From there, we go to the goal. So our goal has to be smart, and we are saying that the patient will be relieved of chest pain within 1 hour of hospitalization. The patient will be relieved of chest pain within 1 hour of hospitalization. So that is our goal. From there, we go to interventions. So all the interventions here should address our goal, to try to achieve our goal. And we are saying that the first one will be, I will assess the level of pain to determine the interventions to implement. So we have to assess the level of pain. If possible, you can include things like using a scale from 1 to 0, meaning 0 is the least severe or the mild pain, 5 is moderate, and 10 is the severe pain, so that you can help the patient to identify the level of pain and you can know the interventions to implement. Number two was saying, I will use diversional therapy such as television, providing television to divert the patient's mind away from pain. So basically here we are trying to divert the patient's mind from the pain. Therefore, we are going to provide diversional therapy. From there, we can go to the next one, which is I will administer prescribed analgesics such as paracetamol. If the pain is very severe, you can give analgesics such as pethidine to block pain sensation, hence relieve pain. So we just want to relieve pain here. So that is the main rationale. Then lastly, we are saying I will administer prescribed anti-inflammatory drugs such as corticosteroids to resolve inflammation, therefore relieve pain. So remember, here in this patient we have inflammation, and it's because of the inflammation that we are getting the patient is getting the pain. Therefore, we want this patient inflammation to be relieved. So those are the interventions that we can easily talk about. From there, we go and look at our evaluation, of which was saying patient was patient was relieved of chest pain within 1 hour of hospitalization, evidenced by patient verbalizing of absence of chest pain. So that is our evaluation. So you have, if you've noticed, all evaluations are having evidence by. So all the interventions should have, the evaluation should have evidence by. From there, now we are going to move to our third problem, which is altered nutrition less than body requirement. So on assessment, you find that in a patient with pulmonary tuberculosis, because of coughing, because of chest pain, because of anorexia, this patient will have poor appetite, or this patient will have lack of appetite. Why? Because of all those reasons that we've mentioned. Even when a patient is just having a simple cough, because of the coughing, they will refrain, or they will not eat as much. Therefore, you find that in patients with tuberculosis, because of the pain, because of the vomiting, because of the nausea, the patient will have um, reduced appetite or poor appetite. So that will be our problem. Our problem will be altered nutrition less than body requirements. Nursing diagnosis, altered nutrition less than body requirements related to poor appetite and anorexia, evidenced by weight loss and general body weakness. Altered nutrition less than body requirements related to poor appetite and anorexia, evidenced by weight loss and general body weakness. We move to our nursing, our goals, our nursing goal. So the goal is patient will have a normal nutritional status throughout hospitalization. So our goal, we want our patients to have a normal nutritional status throughout hospitalization. Therefore, the interventions that we're going to put up will help us to have or to provide a normal nutritional status to the patient. Number one, under the interventions, we are saying I will do oral care, or I will perform oral care to promote free flow of saliva and encourage good breath, which causes nausea. So we will do oral care. When we do oral care, we will promote free flow of saliva and encourage good breath, which will help promote the appetite of the patient. Number two, we are saying I will provide small frequent feeding to promote appetite. Small frequent feeding to promote appetite. Number three, I will encourage the patient to take or to be taking fruits to provide vitamins, which will improve the nutritional status of the patient. So we are going to encourage our patient to be taking fruits to provide vitamins, which will improve the nutritional status of the patient. Intervention number 4, we're saying, I will involve the patient in the planning of his meals so that his food preferences can be taken into consideration to promote appetite. So we want to involve the patient in the planning of the meals, their meals, so that their food preferences can be taken into consideration. And the last one is I will provide a balanced diet that will provide all necessary nutrients to promote a good nutritional status. I will provide a balanced diet that will provide all necessary nutrients to promote a good nutritional status. So those are some of the interventions that we can put under altered nutrition. From there, we'll go and look at the next one. The next one is patients, or the evaluation for our problem is the patient's nutritional status restored throughout hospitalization, evidenced by weight gain. So our patient here will start gaining weight because of the interventions that we have put up. So if you have any questions so far, you can just comment in the comment section so that we can address them in the next video. We move to our fourth problem, which is activity intolerance. So where is this activity intolerance coming from? So under the signs and symptoms, you find that our patient will experience fatigue, they will experience weakness, and this is because of poor breathing or poor breathing pattern that will result in less oxygen in the body. When there is less oxygen in the body, that means there will be poor oxygen or poor tissue perfusion of this oxygen. So this oxygen will not be going into the tissues as required. Therefore, the patient's activity will reduce. That is why we've used our problem, which is activity intolerance. We move to our nursing diagnosis. Our nursing diagnosis is activity intolerance related to imbalance between oxygen supply and demand, evidenced by verbal reports of fatigue or weakness. So the reason why there's activity intolerance is because there's an imbalance between oxygen supply and demand. And how will you know? It's because the patient will report to say they feel tired, fatigued, or weak. From there, we look at our goal. Our goal is report patient will report the ability patient will report the ability to perform required activities of daily living by the time of discharge. Patient will report the ability to perform required activities of daily living by the time of discharge. So our goal is SMART. We want our patients to start doing activities of daily living. Number one, under the interventions. Number one, we are saying I will assess the patient's response to activity to determine the level of activity tolerance. So the first thing that we'll do, we are going to assess the patient's response. So we are going to allow the patient to do one form of activity, and we are going to assess if they can tolerate, or how far they can tolerate. Number two, I will gradually increase activity with activity range of motion, exercise in bed, increase in sitting, and then standing to prevent over excision. So what we are talking about here is that our patient, in our patient who cannot tolerate activity, we are going to gradually increase the activity range. So the first thing that we are going to do is tell them maybe to move their legs, their hands, their limbs while they're in bed. From there, we are now going to tell them to start sitting. Then from there, we are going to ask them to start standing gradually so that we cannot put too much pressure on them. Over excision of pressure. We do not want to put too much pressure on them. The third point is I will encourage the patients to refrain from performing non-essential activities to save energy. So we are going to tell the patients to refrain from performing non-essential activities. Then lastly, we are saying I will encourage the patient to perform activities at a slow pace in a longer time with more rest or pauses to increase tolerance to a disease. So what this means, tolerance to activity, sorry. What this means is that this patient of ours, are going to encourage them to take or to perform activities at a slow pace, slowly. And within that period, we are going to tell them to take longer times and rests in between the activity so that they will easily tolerate or they can build tolerance to that activity. Then we look at our evaluation. Our evaluation is patient reports ability to perform required activities of daily living, evidenced by patient performing self-care activities. So we're simply saying the patient will report an improvement in the ability to perform activities of daily living by evidenced by performing activities self-care such as brushing the teeth, bathing, even eating. Then from there we go to our last problem. Our last problem is high risk for infection spread. High risk for infection spread. So we know that tuberculosis is an infectious condition. Therefore, there is a high risk of being spread, especially in the acute phase. So that will be our problem. Our nursing diagnosis is high risk for infection spread related to the infectious nature of tuberculosis. So high risk for infection spread related to the infectious nature of tuberculosis. So we know that tuberculosis is an airborne disease. So when we say infectious nature, we also include things like airborne disease, which can be transmitted through the air. Our goal, our goal is to prevent the patient from infecting others in the ward during the period of admission or through hospitalization. So it can be during the period of admission up to um, hospitalization, meaning throughout hospitalization. That is our goal. Then from our goal, we go to the interventions. Our intervention is number one, I'll put the patient in isolation to prevent possible transmission of infection to others. So what we want here is to put the patient in isolation so that the patient will not transmit this infection to other people. Number two, I will provide a sputum mag to promote proper disposal of the expectorate and disinfection. So what we are just saying here is that we are going to provide a mark, a sputum mark, that the patient can easily dispose of those sputum that they are spitting out, and it will be easier to disinfect. Number 3, I will teach the patient to cover the mouth whilst coughing or sneezing to minimize the spread of the microorganism in the air, as the transmission is through the droplets. So we are going to teach the patient to cover the mouth whilst coughing or sneezing to prevent spread of infection. Number 4, I will restrict visitation by the outsiders. I will restrict visitation by the outsiders to prevent others from getting the infection. So we are going to make sure that we restrict visitation. Tuingire vya orange that this step. Ah. So we're going to make sure that we restrict visitation by the outsiders to prevent spread of infection. And our last intervention is I will nurse the patient using barrier nursing to prevent the spread of infection. Remember, the patient is the one who is infectious. So we are going to implement barrier nursing so that you protect yourself as a nurse or as a medical personnel from contracting that disease. So those are the interventions under spread of infection. And lastly, we look at the evaluation, of which we're saying evaluation is spread of infection has been prevented without hospitalization, evidenced by no tuberculosis cases from the patients in contact with the patient. So no one who was in contact with the patient during the hospitalization period has contracted the disease. So that is our evaluation. So those are the problems that we've managed to come up with. But we can also talk about problems such as anxiety, knowledge deficit. All these are problems that can be included in this nursing care plan. So those are the ones that we have. So let's not forget to subscribe, like, and comment. Okay, we've come to the end of our lesson. God bless you. See you next time.